Hi everyone, thank you for tuning in and welcome back to my channel. Today I'm diving into the world of temporary dermal fillers, toxin injections, and emerging skin rejuvenation injections. Botulinum toxin injections are the most sought after non-surgical aesthetic treatment globally, the second being botulinum toxin A injections. Whether you're considering fillers, skin injections, or just curious about what they can do, stick around as I cover the key areas that you need to know. So what exactly are temporary dermal fillers? These fillers, especially hyaluronic acid fillers and bio-stimulators, are extensively used in cosmetic procedures aimed at facial rejuvenation and enhancing soft tissue volume. They effectively address facial wrinkles, folds, and volume depletion while maintaining a favorable safety profile. Over time, these fillers are broken down by the body and repeated injections are required to maintain appearance. The rate at which this happens depends on the type of filler. Let's get into the approved uses for fillers. There are three main indications. Number 1, facial wrinkles and skin folds, including nasolabial folds and perioral wrinkles. Number 2, fillers are effective for enhancing volume areas such as the lips, the cheeks, the chin, and the back of the hands. Number 3, atrophic acne scars and also HIV lipoatrophy. Now let's talk about the different types of temporary fillers available. HA, or hyaluronic acid, is a naturally occurring polysaccharide found in our skin. It binds up to 1,000 times its weight in water, making it effective for adding volume. Plus, it doesn't require allergy testing. Advances in technology have enabled the creation of HA products that can last up to 18 months. These products use cross-linking technology with hydroxyl groups to improve the durability of modern HA fillers. The property of HA affect the characteristics of fillers, including their use, injection ease, volume, total cross-linking in the formula, and product viscosity or G'. This determines if the product has enough firmness for structural support to areas such as the chin, cheeks, or jawline, where definition is the feature. Calcium hydroxyapatite, or CAHA, is a sterile opaque implant made of synthetic calcium hydroxyapatite in a gel carrier containing glycerin, sodium carboxymethylcellulose, and sometimes mixed with lidocaine and sterile water. The formula is 70% gel and 30% CAHA microspheres. After injection, the gel is broken down by the body, while the CAHA particles act as a scaffold to promote collagen production. Its effects can last up to 2 years. However, CAHA does not dissolve easily, which can pose certain risks. Polyl-lactic acid, or PLLA, is a synthetic biodegradable polymer that promotes collagen deposition by stimulating an inflammatory tissue response. The volume correction achieved can also last for up to 2 years. There are other combinations like HA with polypeptides, PLLA plus CMC, and PCL, which was approved in 2009 for subdermal implantation. Now let's discuss potential complications. Early reactions may include injection site reactions, nodules, the Tyndall effect, infection, hypersensitivity, swelling, bruising, asymmetry, and lumps. More serious complications like blindness is rare, and vascular issues can lead to tissue necrosis and stroke. These situations require immediate medical attention. While we're on the topic of aesthetic treatments, let's touch on botulinum toxin. First used for strabismus in 1977 and then discovered for cosmetic applications in 1987, it's effective in smoothing facial lines. When botulinum toxin A is injected into the muscle, it blocks neuromuscular transmission by binding to surface receptors on motor nerve terminals. This process allows the toxin to enter the nerve terminals and inhibit the release of the neurotransmitter acetylcholine, leading to a reduction in activity in the targeted muscle. The FDA has approved it for several uses, including frown lines, crow's feet, horizontal forehead lines, and hyperhidrosis, or excessive sweating under the arms. Botulinum toxin is used for other cosmetic purposes that may not have official approval, such as treating muscular hyperactivity in areas such as bulky masseters, gummy lines, and even platysmal bands in the neck. Injections are often done as an in-office procedure with an onset of action at around 2 weeks and lasting 3 to 4 months. Temporary bruising and swelling may occur, and depending on the area of injection, eyelid drooping, spocking, and difficulty swallowing can also occur. Cases of decreased treatment effectiveness has been reported, and antibody formation that neutralizes the toxin has been implicated, although the mechanisms are unclear. Some treatment failures may also be due to inadequate doses, incorrect technique, product handling, or storage. Some studies have found an association between more frequent treatment and higher doses, so it is recommended to use the lowest effective dose at the longest feasible interval, usually 3 to 4 months. Let's explore some emerging cosmetic therapies. PRP, or platelet-rich plasma, also known as the vampire facelift, has become popular for skin rejuvenation and hair restoration. PRP is a concentrated part of blood rich in platelets, which help the blood clotting and healing. It is prepared by collecting a small amount of blood, which is then spun into its separate components, and the PRP is then collected for use. It shows promise, but there is no international consensus on how to prepare and apply PRP for cosmetic purposes, complicating its regulatory approval. The majority of studies fall under lower evidence levels, such as case series without control groups, which limits the ability to conduct meaningful meta-analysis. PRP is generally regarded as safe with few reported side effects, primarily due to its autologous nature, which minimizes the risk of immunogenic responses. More rigorous studies are necessary to establish standardized methods and confirm their efficacy. Exosomes are gaining attention for their potential in skin rejuvenation, wound healing, and hair growth. However, their use in cosmetics is still being researched, with most evidence coming from preclinical studies. The tiny structures, around 30 to 100 nanometers in size, are produced by cells in the form of vesicles. Exosomes show promise in skin rejuvenation, hair growth, wound healing, cell migration, and rebuilding skin structure in lab and animal studies. Few clinical trials exist, and most evidence is anecdotal or from small-scale studies. For example, exosomes from fat tissue showed limited and temporary skin brightening effects. Combining exosomes with laser therapy improved acne scar treatment. Exosome use faces hurdles like high costs, complex extraction, lack of standardized methods, and limited safety and efficacy data in humans. Polynucleotide, or PN injections, are becoming popular in cosmetic dermatology for improving skin quality and treating skin conditions. PN is made from purified DNA, around 50 to 200 base pairs taken from salmon trout sperm. It is broken down by enzymes into components that stimulate fibroblasts and promote healing by improving blood flow. Animal studies show faster wound healing after laser treatments. It has been used by cosmetic physicians to treat enlarged pores, rejuvenate skin, improve skin texture, and reduce wrinkles, with reported positive results. Some studies show significant improvements in acne scars and wrinkles, suggesting benefits like better skin elasticity, hydration, and appearance. That's why it's commonly referred to as a skin booster as opposed to a filler. It is generally considered safe, with no serious side effects reported in studies. However, the study sizes are small and follow-up short. Standardization with larger trials is needed. In conclusion, while temporary dermal fillers and related treatments offer exciting options for rejuvenation, it is essential to consult with a qualified professional to ensure safe and effective results. Remember, the aesthetic landscape is ever evolving, so stay informed. If you found this video helpful, give me a thumbs up, subscribe, and hit that notification button for more insights into beauty and aesthetics. Let me know in the comments if you have any questions or topics you'd like me to cover next. Thanks for watching, and see you in the next video.